The legal aspects of therapeutic medication management. After exploring this chapter, students should be able to describe how athletic trainers deliver healthcare services under the direction of a licensed physician. Explain the legal requirements for athletic training practices as it relates to therapeutic medications. Differentiate between administering, dispensing, and storing medications in the athletic training clinic or facility. Identify drugs according to the current schedule of Controlled Substances Act. Describe the prescribing authority of various healthcare providers or prescribers, and discuss the legislation that affects athletic trainers traveling with medications domestically and internationally. Healthcare providers with prescribing authority. Multiple healthcare providers have prescribing authority. Athletic trainers often collaborate with many medical providers who have the authority to prescribe medications. All prescribers must follow the federal and state laws when prescribing medications in a legal and ethical manner. Some examples of healthcare providers that have prescribing authority include, but are not limited to, medical doctors or doctors of osteopathy. These individuals may prescribe controlled substances. A physician's assistant or an individual with a doctorate of a nurse practitioner can possibly prescribe controlled substances. An individual with a doctorate of pharmaceuticals. Their ability to prescribe medications varies by state. DPMs, ODs, doctorate of dentistries, DMDs, or a doctorate of psychology. Individuals with these degrees may be able to prescribe medications specific to their practice. A doctorate of chiropractics may be able to prescribe medications depending on their scope of practice and depending on their state practice act. Athletic trainers are often on the front lines and frequently serve as the liaison between the patient and the provider. We are often the advocate for the patient. It is our duty to educate and inform the athlete of the risks of medication, and the healthcare provider should prescribe medication to enable continued participation, only if doing so is consistent with the athlete's best health interest. Prescription drugs or medications. These are pharmaceutical drugs that legally require a medical prescription to be dispensed. Over-the-counter or OTC drugs. These can be obtained without a prescription. Athletic trainers and other healthcare providers must follow federal and state guidelines and laws regarding the administration and dispensing of medications, particularly regarding minor athletes. In many states, the athletic trainer is not permitted to administer over-the-counter medications to minors under any circumstances. However, the school physician, school nurse, parent, or legal guardian, and the affected student can administer a medication. The difference between drug administration and drug dispensing. Drug administration. Drug administration. This is the direct application of a drug to a patient. This is usually one dosage of the medication for immediate use or within the first 24 hours. Whereas drug dispensing, this is the preparation and provision of a drug for later use. This is usually multiple doses of a medication, and this must follow labeling, packaging, and record laws. The care of an injured or ill patient may be the responsibility of one healthcare provider or as part of an interprofessional healthcare team of multiple providers. Different members of the sports medicine team may manage different medications within their scope of practice. Storing, packaging, transporting, tracking, administering, and dispensing both over-the-counter and prescription medications is extremely important. The team physician or directing physician takes a leadership role. These individuals are usually a primary care physician or a family practice physician or maybe an orthopedic surgeon. These physicians may volunteer their time or may be hired by the professional team, college, or university to provide medical care. The directing physician should be responsible for medical records and medications that are distributed from or stored at the facility or related locations. The Accredited Association for Ambulatory Health Care and Joint Commission typically accredit many collegiate student health centers and hospitals and have developed specific standards for the use of sample medications. Although athletes are ultimately responsible for avoiding prohibited medications and obtaining therapeutic use exemption waivers, healthcare providers should be familiar with medications that are banned or restricted by relevant sport governing bodies. The role of the athletic trainer. Unless explicitly authorized by individual state practice acts, athletic trainers cannot dispense prescription medications, even under standing orders or with permission from a physician. Athletic trainers are allowed to administer over-the-counter or OTCs and specific emergency prescription medications, such as an epinephrine autoinjector or naloxone, depending on the State Practice Act. Athletic trainers must follow current state and federal laws. Some states allow physicians to delegate authority to other healthcare providers. Athletic trainers may act as a caretaker or an agent of a physician. However, the physician is ultimately still responsible for the storage and other precautions regarding medications. Athletic trainers work in many settings, and all of them must have proper storage and dispensing guidelines regarding medications. Federal and local laws must be followed at home and when traveling regarding medications. Many athletic trainers become a medical resource for patients, including for their medications. Athletic trainers should develop storage, inventory, and documentation policies. This includes appropriate documentation of any distributed medications. Athletic trainers should understand the role of athletic training students who are enrolled in a CADI accredited program. The best practice for students should be prohibiting non-certified or unlicensed students from furnishing any medications. The guidelines regarding AT students should be outlined in the facility's policies and procedures. Student aides not in a CADI accredited program must follow the same rules. All faculty, staff, students, and student aides should follow the requirements from the directing physician regarding the standing orders in reference to all medications in the athletic training facility. There is an NATA position statement called the Inter-Association Consensus Statement, the management of medications by the sports medicine team, that was published regarding the best care and best practices for medications in the sports medicine facility. I would encourage you all to read this. The guidelines for managing medications. A drug is considered any substance other than food or water that is consumed, inhaled, injected, smoked, absorbed via a patch on the skin, also known as transdermal, or dissolved under the tongue, also known as sublingual, to create a physical and often psychological change within the body. The responsible provider must be authorized by the state. There are various U.S. federal agencies that regulate how medications are dispensed and administered. One of these agencies is the Drug Enforcement Administration, also known as the DEA. It enforces federal laws related to controlled substances. Prescribers may transport controlled substances to locale only with a DEA license. Orders written for the team are not permitted. Athletic trainers may have limited responsibility for administration of drugs. Coaches may not be involved with medication management, and athletic training students should not manage medications either. Violations for the mismanagement of medications can carry significant fines and possible sanctions for individuals and universities. This is an article that I would encourage you to read. This article is titled, Adherence to Drug Dispensation and Drug Administration Laws and Guidelines in Collegiate Athletic Training Rooms, a 5-year review. Although this was published in 2010, a total of 2,330 athletic trainers provided 1,535 usable responses. I think it's important to note that only 55.5% of athletic trainers stored medications in a locked box or locked facility, compared with 67.1% of the individuals surveyed in 2001. A large number of individuals administered over-the-counter drugs in any amount necessary, and 3.6% allowed athletes access without any consultation. That's a little bit scary to think about. I would encourage you all to read this. Administering and disposing of drugs. Let's review again. Administration is giving a single dose for immediate use or within the first 24 hours, and dispensing is preparing and providing multiple doses of a drug. There is a formulary. This is a list of medications that are used by healthcare facilities. Athletic trainers must have a formulary when traveling. Dispensing of over-the-counter drugs should be based on the direction of a physician. Generally, no medication should be administered to minors. Athletes older than 18 years of age should need an assignment of benefits form that is signed prior to providing medication. Over-the-counters and athletic training students. Athletic training students should never convey over-the-counter medications to patients. This means they should never be given out by students. Athletic training students should not even stock inventory to maintain compliance. Federal and state laws. Federal agencies involved in the medication regulation. The Food and Drug Administration, also known as the FDA, regulates safety, efficacy, and the security of drugs. The Drug Enforcement Administration, also known as the DEA, enforces laws related to the controlled substances. And the Occupational Safety and Health Administration, also known as OSHA, oversees concerns regarding hazardous drugs. Drug legislation. Here are some of the different drug legislations that have happened over the years. We have the Pure Food and Drug Act of 1906. This prohibited the mislabeling and the adulteration of food and drugs. The Harrison Narcotics Tax Act of 1914. This established the regulation from the use of opium, opioids, and cocaine. Later, marijuana was added in 1937. The Food, Drug, and Cosmetics Act of 1938. This required the safety and purity testing for new drugs. The Kefauver-Harris Amendment of 1962. This required proof of efficacy as well as the safety for new drugs. The Controlled Substances Act of 1971. This scheduled regulated substances. And then we have the Dietary Supplements and Health Education Act in 1994. This established standards for dietary supplements. The Controlled Substances Act of 1971. This classifies drugs as per schedules based on the potential for abuse. This is accepted highly in the medical use and addiction concerns. Schedule 1. There's no medical use and there's a high potential for abuse. Schedule 2 drugs have high abuse potential and psychological dependence. Schedule 3, there's a moderate to low potential for abuse and dependence. Schedule 4, there's a low risk for abuse and dependence. And finally, Schedule 5, there's a lower abuse potential than Schedule 4. Traveling with prescription medications. There are guidelines for sport health care providers who travel outside of their state. We should exercise caution to ensure proper medication management. The management of controlled substances cannot be delegated to an athletic trainer. This should be handled by a healthcare physician or other individuals that have prescribing authority. Sports Medicine Licensure Clarity Act happened in 2017. Athletic trainers and sports healthcare providers will have protection when they're away from home. This means that they are covered under their home licensure governing body. This means when healthcare providers are traveling with their team, that the care that they provide away from home will be covered under their home state licensure. International travel. Individuals traveling internationally should consult with the host nation governing the organization prior to the trip. You should carry as little inventory as possible regarding medications and rely on your team physician. You should be aware of unique local regulations regarding over-the-counter medications and/or prescription drugs. You should avoid any medications that could potentially cause a positive drug test within your international organization. You should be well aware of the international organization's laws and rules regarding medications before you travel. Drug development. Establishing a new drug is a very complex process. For example, the COVID-19 vaccination. There are multiple steps that could require potentially years to complete. There's the development process, which requires preclinical research, microorganisms, and animal research. The company must file documents with the FDA to initiate clinical trials, and then patients eventually are involved with clinical trials. Drug studies eventually begin after the investigation of new drugs researched. After an IRB approval is obtained, there are several steps required to earn FDA approval. In most cases, this process is long and arduous, most often taking between 17 and 21 years for new drug approval processes to occur.